Hello there, how are you? I'm Dr. Cervical, and today I'll show you how to look for lymphadenopathy in the neck, so cervical lymphadenopathy. So here we have our patient. Assalamu alaikum. I'm Dr. Cervical. কেমন আছেন আপনি? আমি আপনার একটু গলা গ্রন্থিগুলো একটু পরীক্ষা করব আপনার কোনো সমস্যা হলে। So before starting examination of the lymph node, first we have taken the consent of the patient and introduced ourselves, and then we have to know some certain points that we are going to look for. So first of all, cervical lymph nodes, we start from the submental, then submandibular, preauricular, postauricular, anterior chain, posterior chain, scalene group, and suboccipital. So those are the common lymph nodes that we see. And the things we look for is first, is the lymph node enlarged or not? Next, what is the consistency? Are the lymph nodes matted? Okay, so those are the most common questions that we ask. And in some patients, is there a discharging sinus or not? Okay, so those are the most common things that we look for. And one thing that you must remember, that you have to move actually from front to back to examine the lymph nodes. So I'm actually moving from front to the back of the patient, and I will ask the patient to flex his neck a bit to have a nice palpation of the lymph nodes. আপনি আমার দিকে তাকান, আমি যখন আপনার হাত দিব আপনার এখানে গলার মধ্যে, আপনি একটু এরকম করবেন, অল্প একটু, খুব বেশি না। দেখেন আমার দিকে তাকান, এই যে ওকে, একটু নিচের দিকে করেন, হ্যাঁ। So now we are looking for submental, submandibular, preauricular, postauricular. Then we'll actually move the patient's head to one side, and this is the sternocleidomastoid, and we have to look for anterior chain in this side, and then posterior chain in this side. Move the patient's head in the opposite direction. This is the sternocleidomastoid, anterior chain. So we start from above, then we go below nicely and smoothly. Then we'll look for posterior chain. There is no, and then ultimately we have to look for occipital lymph nodes. Okay, or suboccipital lymph node. And we can also see another lymph node, which is scalene, and we can see it in between heads of the sternocleidomastoid. So like here, so we have to actually put our finger and push it as far as we can. So in this, we do it that manner, and here we do it that manner. So we have to push, and actually we can move our finger to get a good feeling of the scalene lymph nodes. So those are the most important things that we see in the lymph nodes. Okay, so now, and also one thing is we can also see supraclavicular lymph node in some cases, but it's not essential, but it's good to look for. Okay, so the most common findings are, first of all, if the lymph, we have to assess if the lymph node is tender or not. If the lymph node is tender, most likely it's an infection. And in case of cervical lymphadenopathy, which is tender, most likely the infection can be in the oral cavity or ear or nose, so any part of the ENT. And if the lymph node is firm, maybe infection is also called firm lymphadenopathy. If the lymph nodes are rubbery, we have to think of lymphoma. If the lymph nodes are matted together, we have to look for TB. And in case of TB, there can also be some discharging sinuses. Okay, so those are the most common things that we assess. And if someone asks what are the most common causes of lymphadenopathy as a whole, so especially generalized lymphadenopathy, so most common causes of generalized lymphadenopathy are, first of all, malignancy like lymphoma or leukemia, infections like tuberculosis, Epstein-Barr virus, sometimes HIV, and some collagen diseases like SLE and RA. So those are the most common things that we actually assess during examination of the lymph node. আপনাকে ধন্যবাদ. Thank you. So thank you all.